Well, good morning. My name is Taylor Randall. I'm Dean of the David Eccles School of Business at the University of Utah. We're pleased to welcome you to this installment of Navigating COVID-19, How to Save Your Business. It's being brought to you by the Mariner S. Eccles Institute for Economics and Quantitative Analysis. We're thrilled to be broadcasting this series throughout all the state of Utah to all small businesses and beyond, thanks to the generous underwriting of the George S. and Dolores Dory Eccles Foundation. What you'll hear today is an intellectual partnership with Levitt Partners, the Sinosure Group, the Salt Lake Chamber, and the Governor's Economic Task Force and their plan, Utah Leads Together. Today, we're going to talk about how we get your business back to work, how we rejuvenate this economy and bring it back. We're thrilled today to have as our host, former Governor Mike Levitt. He's also the former Health and Human Services Secretary of the United States of America. We welcome Mike and his insights. Mike, over to you.
Well, thank you, Taylor, and welcome to everyone who's participating. We've now gathered several times, and our purpose, as Taylor suggested, is to talk about the way to save your business. I'd like to highlight 6 different points that have been developed through the course of our gatherings, just as a review. The first important point on saving your business is to recognize that COVID-19 is a long-term risk that needs to be managed. This is not a short-term issue that will simply be solved. Number 2, our social distancing models are working. What we're doing is working. We're outperforming the models, and that's very good news. But we shouldn't stop social distancing too early, nor can we start too late. Think about it as in this way. Imagine that you are walking out on some new ice. Take a few steps, you pause, and then decide if you're comfortable and that it's safe to go a few more steps forward. Or you might decide it's a bit uncomfortable and take a step back. That's the process that we're going to begin today, or we're going to talk about today, that as our state is going to begin very soon. Now, it's important to realize as well that pandemic viruses do typically have waves, sometimes 2 or 3 waves. And those occur, to use my metaphor, when we move too quickly and break through the ice. And when you break through the ice, it takes some time to get warm again. So we've got to be careful. We've got to move because we need to get to the other side of this, but we also need to be careful. The next point, we need to act promptly, even if what we're doing isn't perfect. We reiterate. This is a model where in business you have to move forward despite being a bit unsure, and then reiterate to find perfection. Next, utilize all the resources that you have at your command. The CARES Act, many of you will have taken advantage of that. If you haven't, more help is coming. You should apply. Work with your credit partners, such as your bank and others, to make that happen. Next, communicate frequently with all of the stakeholders that are in fact involved. For example, employees, customers, your financial partners. Communicate, communicate, communicate. And finally, look for ways that you can adapt your business to prepare for a new normal. Things will not be the same, but we can succeed, and we'll get through this, and we'll save our businesses. So it's my pleasure now to introduce Steve Alter. Dr. Alter is a health ecologist at the University of Utah, and will talk to us a bit today about understanding the virus and how, in fact, it can be communicated. Steve?
Wonderful. Thank you, Secretary Levitt. It's good to be with you again. And as we look at the next few weeks where we are likely to see the reduction of restrictions in the state, we've pulled together today a group that can help us think about what we need to do to start opening up business in a way that keeps employees, customers, and frankly, our communities safe. We have a terrific group that we've brought together. We're going to hear from Del Sanders with Health Catalyst, who's going to talk to us about the risks associated with bringing people back to work, and in particular, what we can learn from data and how data can help guide us through this process. We'll hear from John Pullman with Levitt Partners on the new color-coded health guidance system that's been adopted by the state of Utah, and some practical ways that this can be applied to your businesses. Finally, we've pulled together a terrific panel of business leaders within our community who are under what are considered essential businesses, and they're going to help us understand from their practical experience what it's like to operate under conditions of COVID-19. And then, of course, we'll finally have an opportunity for questions and answers at the end. If you would like to submit a question, please use the chat function that's contained in this YouTube presentation. And we'll be monitoring those, and then we'll be able to have those for that section. So anytime during the presentations, please submit your questions. And thanks to Andrea Thompson, one of our great faculty members at the Eccles School of Business. She will be both moderating that discussion with our business leaders and also helping us to manage those questions for each of you. Now, we are learning as we go along about COVID-19. That's something that it's hard to turn on the television or look at really any direction and not see something about the pandemic. It's certainly on all of our minds. A few reminders about what we know about the spread of this particular disease and the virus associated with it. First of all, we know that close contact, being within 6 feet of somebody, and that's of course a rough estimate, but within 6 feet of an infected person, puts us at risk of being infected ourselves. Now, the challenge with COVID-19 is it's a tricky virus. The SARS-CoV-2 virus that causes it, it can be spread even when somebody doesn't have the symptoms of COVID-19. And so it's a little hard to determine who has it and who doesn't. The spread is through respiratory droplets. So if somebody coughs, sneezes, or even when they're talking, these respiratory droplets are spread. And if somebody is infected, those respiratory droplets will contain the virus, and that's how people get infected. Unfortunately, those respiratory droplets are heavy and they tend to fall out of the air relatively quickly, but still we need to think about that distancing. We also need to understand that when these droplets fall, they will end up sometimes on surfaces, and those surfaces are another way we can pick up the virus. If we touch a surface that has been contaminated by the respiratory droplets of somebody who's infected, and then we touch our eyes, our nose, or our mouth, we then put ourselves at risk for this particular infection and the disease associated with it. So we've heard this, but we just want to distill down what are some of the appropriate ways to prevent the spread. Well, first of all, social distancing. Stay away or stay apart. If you can't stay away, if you need to be in a place where other people are, make sure you're staying at a distance from them. Personal barriers. Now, there's been a lot said about masks. Masks are a great way for us to keep whatever we have from infecting others. There are also masks and other types of equipment known as personal protective equipment that can be worn that protects us from others. Now, that tends to be fairly substantial, and so if we're looking at our own protection, we've seen on televisions in the hospitals and other places where people are actively working with COVID-19 patients, it's the full suits and all the gear. But we can do a lot in protecting others by simply wearing a mask when we're going to be in proximity to others when we're out and about. Environmental considerations, we should think about how do we create a low risk environment? How can we make the environment around us, either by frequent sanitizing or keeping people at a distance or choosing when we have people gathered? How do we work on that? At the end of the day, one of the very best and simplest things we can do is something we learned from when we were very young. Wash your hands. Wash your hands frequently, and then even more frequently. So hand washing is one of our best defenses against the spread of COVID-19. In terms of the business response, have a clear plan as a business. Think about what are the specific adaptations you're going to make when you prepare to adopt the changes in your business for addressing the COVID-19 pandemic. Communicate regularly, and I think we'll hear from our business leaders the importance of communication, so that you are in touch with the people in your business and you are doing your best to be responsive to customers' needs. And of course, electronically when possible. We are all thinking of new ways that we stay in contact with others, and electronic communication, fortunately, we live in a day where that's accessible and works quite well. Rearrange, change your work location. Many people are working from home. Where that's possible, continue that. Look at your work layout. Do you have people that are grouped close together? Can you spread people out? And look at the schedules. Are we able to allow people, say, especially if you have employees or even customers that may be coming on mass transit or other places where they might be in close proximity, can we change those schedules? Reduce the exposures to risks. There are many ways we can think about limiting those exposures. For instance, can we avoid unnecessary travel, whether that's travel around the community or the state or airline travel. But thinking about adaptations like that whenever possible when it's not essential to our business operations. And finally, know what to do if someone in the workplace is suspected of being infected. At the very least, make sure if people do not feel well, there are ways that they can stay away from work and that they have the ability to understand the nature of their illness and can be well before they come back into the workplace. So have a clear strategy for working with your employees if in fact they become ill. This is a tricky virus, again, because the disease that it causes looks very different depending on the person. It can be anything from somebody who seems completely well all the way to somebody who has very serious symptoms. So instead of trying to outguess whether somebody has the COVID-19, if they're not feeling well, then make sure that they can stay away. Now, our first panelist on the discussion today is going to talk to us about how data can help us manage COVID-19 risks. Dell, we're looking forward to your presentation and help us understand the use of data as we try to stay in business. Dell?
Thank you, Steve. Thanks very much, everyone. It's a privilege to share time with you. Today, I'll share thoughts and advice about the data and analytics of COVID-19 and what that means to risk management for local businesses in Utah. This is a worldwide turning point in terms of global data literacy. The entire world is focused on a common understanding of data and analytics like nothing before. We are now armed with data that makes all of us amateur epidemiologists. The thought occurred to me that the only events in history in which the world turns its focus on a common data and analytics environment are the medal counts for the Olympic Games. I'm half joking with full truth there. Speaking of the Olympics, I wore my 2002 Winter Olympics fleece today as a reminder of the global role model that Utah was and can be when it comes to COVID-19. We can be the state that minimizes the human tragedy of COVID-19 through the blessings of our state's amazing healthcare systems, and the state that returned quickly to a healthy economy with new business ideas and models. All it takes is a little deeper thinking, planning, and execution than the average, armed with data. I spent my 37-year career processing and analyzing data to make better decisions. I started out as a command, control, and intelligence officer in the U.S. Air Force, specializing in nuclear warfare planning, policy, execution, and recovery of society. I had the great experience of supporting the Reagan-Gorbachev summits and the START Treaty, and served as a member of the battle staff on what is known as the Doomsday Plane. After the decay of the Soviet Union and rise of organized terrorism, I worked with the National Security Agency in the Nuclear Threat Reduction Directorate, where we modeled and mitigated scenarios that conceptually look very similar to assessing and reducing the risk of COVID-19 and what we called the epidemiology of terrorism. In 1997, I jumped into healthcare after stumbling upon how poorly healthcare was computerized for analytics and decision support. I'm deeply grateful that my healthcare career started at Intermountain, which was the pinnacle of healthcare computerization and analytics at the time, and still is. The only thing worse than no data is bad data that you believe is good. The COVID-19 data environment is fraught with unreliable data right now. As local business leaders, lean on those of us who live in this COVID data world. We are here, we're in your community, we're ready, and we're honored to help. Your businesses, where we eat, entertain, and shop, are the fabric of our families' lives. Health Catalyst is a Utah-based technology and services company of about 900 teammates. Half of those teammates are normally working in Cottonwood Heights. We provide analytics and data science technology and professional services to healthcare systems throughout the US. We operate in 47 states, and our products and services impact about 150 to 200 million patients. The COVID situation is a more urgent version of what we do in Health Catalyst every day. We are analyzing large data sets and use that analysis to advise our healthcare clients, help them assess and reduce risk, plan for COVID surges to manage staffing, medications, PPE, ICU beds, and ventilators. We are focusing a significant amount of our expertise on the evaluation of treatment protocols that could benefit COVID patients. For example, assessing the effectiveness of hydroxychloroquine, remdesivir, and ventilators. We've also deployed a COVID patient surveillance system so that we can spot patients in the hospital who are at high risk of clinical degradation and then suggest interventions to doctors and nurses to prevent that degradation. There are two types of tests for understanding COVID infection rates. The data from those tests is critically important to the COVID battle. One test checks for the genetic artifacts of the virus in your bloodstream, and the other checks for the existence of antibodies. Currently, as Steve mentioned, both of these tests suffer from notable levels of false positives and false negatives. The data is still helpful for decision making. We just need to be aware of and adjust to the imperfections. As business leaders, adjust your confidence in those tests accordingly. If someone tests negative, but is showing symptoms, trust your instincts not to test. By the way, the reliability of these tests will improve over time as the underlying technology and our understanding of the virus improves. As leaders, you'll probably be faced with questions about contact tracing. The data from contact tracing is critically important to reducing the spread of the disease. The Google-Apple partnership to develop a contact tracing system for smartphones is encouraging because it accommodates privacy very effectively. Unfortunately, older smartphones are not capable of supporting the Bluetooth technology that is required by the Google-Apple solution. Depending on the model and manufacturer, smartphones that are 3 to 5 years old will not be compatible. Also worth noting, about 20% of Utah's population have a mobile phone, but not a smartphone. The current timeline for the Google-Apple solution is to roll out the basic technology and then leave it up to the individual public health departments in each state to provide the contact tracing application. I would be surprised if we have a widespread contact tracing solution from the Google-Apple team before July. In the meantime, manual collection of contact tracing is probably our state's best option. Okay, let's talk a little bit about risk management concepts. In the context of COVID-19, risk is defined by the probability of infection times the consequence of infection divided by the effectiveness of mitigation. So let me think about that for just a minute. Probability of infection times the consequence of that infection divided by our mitigators. Next slide, please. Achieving zero risk is impossible. What we need to think about is acceptable risk. For example, if the mortality rate of COVID-19 was equal to or less than the mortality rate of influenza, I suspect our country would have accepted that risk without shutting down the economy. But with mortality rates which are 5 to 10 times higher than the flu, our country decided that the risk was unacceptable and dramatic risk mitigation measures were required across the board of our behavior and our economy. But our dramatic risk mitigation and the impact it's having on the economy is increasing risks to health and mortality. The probability of infection is not the same in every industry segment, and the consequences of infection are not the same for every employee. Now is the time to take a more precise view of risk management by industry segment and by employee and consumer type, informed by the data that we have, adjusting for the uncertainties in that data, and get everyone back to work in a safe and speedy manner. Utah can do it. It will require significant thought and planning, but Utah can do it. And then hopefully we can all get a haircut. Thanks, Steve. That's all I have for now.
Dale, thank you so much. What terrific guidance and advice. So as businesses are trying to incorporate data and risk management practices into their routines, what are some practical ways they can access the right data and determine ways to appropriately take those data into their business practices?
You know, there's a challenge. We have so much data, it's almost like finding a needle in a haystack right now. And so for local businesses, I think this venue and I think the state is the best source of guidance, most consistent place to go for guidance. I wouldn't rely on the CDC. It can be kind of confusing sometimes. Of course, the newspapers like the New York Times have done a really good job of covering the disease as well, but sometimes they have a New York slant to the output. By far the best solution and the best source for this kind of information and guidance comes from the state and the great program here that's sponsored by the U and the Eccles Foundation.
Terrific. Well, thank you. That's terrific guidance, and thank you for sharing your expertise with us today. We've heard about guidelines. We've seen many different types of guidelines that have been established, and we hear about cities going into restriction. We've also seen different systems for determining level of risk. We're fortunate to have John Pullman with us. He's one of the senior directors at Levitt Partners, who is going to talk to us today about the color coding system that has been shared just recently by the state to help us try and understand what the risk level is in our communities, and then give us guidance on how we can adapt to those levels of risk. So John, we look forward to hearing your description of this process and how we can use it to keep our businesses going forward.
Thank you, Steve. And that's the point. We want to keep businesses going forward. On Friday, Governor Herbert released version 2 of his Utah Leads Together plan. Many people at the University of Utah were involved and influential in that. This plan adds on additional details to how to judiciously dial up the economy in a brightener way, not a switch. Also in a way that respects the ongoing public health concern, but loosens up restrictions and instills confidence. There's a great underlining of confidence in this document that I think we all need to pause as we think about the economy. If employers and customers don't feel safe and that their safety is being appropriately considered in the workplace or as consumers, they won't re-engage with the economy. So therefore, a large degree of this and these guidelines are not only to help employers, but how to help employers help consumers and their employees feel safe. So the plan, and if you look at the first slide that has the color dial here, this plan, among other things, includes a color-coded health guidance system. So think of this like our air quality or fire safety notification systems. It gives guidance on how to modify behaviors based on the prevalence of a risk. The system comes from a group really from the Utah Economic Response Task Force set up by the state. This was led by the governor's office and the Department of Health. Levitt Partners provided research and expertise, and I should say I'm a consultant. I'm not representing the state fully, but I can confidently explain its contents. But the input also came from the Salt Lake Chamber of Commerce, the Utah Restaurant Association, Larry H. Miller Group, and the medical systems of the U and Intermountain Healthcare, among others. So it was well informed by a lot of different organizations as well as national research. So what it does, it identifies as 4 phases of opening up the economy. Right now, we're in the red phase, high risk. There are lots of restrictions and they're essential to contain this virus. Fortunately, these seem to be working, and there are indicators that we can begin loosening up now, and there's a desire to do so soon. That next will be that next stage will be this moderate risk or orange. We hope to be there shortly, perhaps even by the end of the month. This is where we have more confidence that our actions are limiting the spread, but it's still a bit of a testing phase as we loosen up these restrictions. We hope soon, we hope that orange phase really doesn't last too long, that we can get to this low risk phase, yellow. This will be an environment in which we live in for quite some time. It means we have the virus under control and we're working to prevent flare-ups that might occur. Then we get to the green, the new normal risk. We won't see this until we have a vaccination or reliable treatment or some natural herd immunity. It is the new normal and it's out there in a distance, but there are still lots of things we can do to open up the economy as we wait to get there. Note that we can move forwards or backwards on this dial, and there are some key metrics that will help let us know when to do that. That's growth of the virus, availability and prevalence of testing, capacity of hospitals, among others. And as we see those indicators vary, and there's some great data coming in at the state level, they can identify whether it's time to move or not. The guidelines include recommendations for the public and employers. I'll talk briefly. So under the employers, there are guidelines for all employers, really, no matter what your industry, and that pertains a lot to hygiene and testing your employees that really transcend all businesses. But then there's some industry-specific ones. We identified 13 specific industries that you can see listed here. There's some additional ones the team is thinking about and that will come soon. It's not meant to be comprehensive, and there are many guidelines that associations of these different industries might provide that will be helpful in addition. But the state really wanted to give guidance on what are the next steps organizations and businesses can take. I want to call it just a few excerpts so you have an idea. This is a 16-page document. So if you go to the next slide, there is a link to the website. I encourage you to go and download it. I'll just call out a few specific ones here. This first is on social guidelines. Of course, social is important for businesses because this is what your employees are going to be thinking when they're not on the job, or your customers are going to be thinking it as they go out. If you can see in high risk and moderate risk, it's essentially the same thing. We are taking public precaution. We're going to be 6 feet away from each other for a long time. But as we move from high risk to moderate risk, we're going from not leaving home except for essential things to Dale can finally go get that haircut, or I can get the corrections to my home done haircut. So it does start to expand that a little bit, as well as limiting groups. We've been at 10 people. We hope to get to 20 people. As you move into yellow, you're opening up to 50 people, which you can see would be very relevant for weddings and funerals, where you can have more guests there. Still continuing to encourage reduced travel, but mainly to high-risk areas. We really hope we can get to yellow, though, as soon as we can. If you go to the next slide, though, that focuses on the employers, so if you think about your companies and flexibilities that you can bring in, we still feel that employers need, even as we move from red to this orange phase, extreme caution. This is a testing phase. Be encouraging still of your employees to work remotely where possible. You evaluate your workforce concerns, you do strategies, as Steve mentioned earlier, and Dale, about how to minimize your impact. A lot what this series is about. All of this will be very relevant. We should be monitoring our workforce for symptoms. As we get into a low risk phase, maybe there's some shifting you can do of your employees, still doing some remote work, and you're still following the social guidelines. but there's more things you can do with your company, and more importantly, there's more things that your customers can do. As we move from red to orange, there are a few industries that are particularly affected in great ways. Of course, there's restaurants that do dine-in services, gyms and other retails that have been encouraged to be closed at this point. They can open, but with great precautions added to them. So while we're loosening some restrictions with sort of a hard line, there's an added element of, yes, reduce, but add these additional thoughtful things to it. Entertainment, it might be preferred for organizations that have reserved seating, so you can set up that different spacing, social distancing between consumers, and that's the same at restaurants. I actually wanted to hit, and if you go to the next slide, we can talk just briefly about restaurants, because this is a hot topic that a lot of people are concerned about, and rightly so. It's a big driver of our local economy. So there's an opening up of dine-in with appropriate precautions. We should know that restaurants really is one of the riskiest environments. These are individuals sitting for prolonged periods. There's a lot of surfaces. There's typically close interactions. And if you look at the guidelines at the very last page, there's an appendix that talks about all the things to consider if you're in the orange range and you're in a dine-in restaurant. Things like limiting your party size, keeping table space a certain amount of feet apart. Really in the orange phase, we're still encouraging carry out, but you can order in the store. We encourage high-risk populations still not to attend, but that can start easing up as you get into the yellow a little bit more. But we're still these social distancing guidelines are still gonna apply in every business. And so as you think about opening up your businesses, there's permission to do so. Think about how you take those social guidelines and apply them to how your consumers interact, how your employees interact, and adapt specifically. There will be a time in which we can pack the restaurants again, and they can be at full service, and we're looking forward to that. For the time being, because of the nature of a pandemic, we just have to be extra cautious with these things. Before I end, I just want to give two really important caveats, frankly. There are multiple guidelines coming out from different government entities. Last week, the federal government released these guidelines for opening up America again. This was a plan that had some metrics, that had some guidelines. It was not very detailed and fairly deferential to the state. The next day, this was actually great timing because the state was ready to release its plan the next day, in recognizing that there is, and still with a belief that local is better. Although pandemic means a global pandemic, we know that healthcare is local, health is local. And so the state has then laid out these different guidelines. This is still in the category of a directive, not enforceable by law. So these guidelines you're seeing really encouragement. The state also believes that local matters, and so counties have set up additional provisions. So as you think about opening up your business, both the timing and the provisions in which you do it, be sure to go to your county website. A number of them, maybe half or so, have implemented some guidelines, are also making plans to ease the restrictions. They have all the incentives to do as much as the state does. But you can see there are some specific provisions, and some of those can be enforceable by law with penalties. And so it's something as individuals and businesses you need to be checking in on. The other thing I'll just add is check back as you hear there's a movement of going from red to orange or orange to yellow. Check back on these websites and what's being released. The challenge with this virus is we learn more all the time, and we're trying to be as flexible as we can, but we have to put in provisions and loosen them as much as we can. And as we learn more about the disease, we will do that. So check back in a timely way. As far as what's coming up next, the state legislature in an emergency session right now is setting up a commission that will refine these recommendations, that will help identify what that triggering point is for moving from one color to the other, and hopefully not back again. And those recommendations could influence some of what you see here. The bottom line is it clear the states, the regions, the communities, everyone wants to open up the economy as much as we can, and this will give us an opportunity to do so. while we talk about states and local elements, what we really hope we can get to with the color-coded system is getting down to the community. So the communities themselves might need to have additional stricter provisions, but that won't slow down the rest of the state, the region, the state, the county economy from moving along. And additional testing and monitoring will help get us there as soon as we can, which is why the state and the governors put such emphasis on this. So go download the document, more to come. Really exciting to see such great efforts being put into waking up the economy as much as we can. Thank you, Steve.
John, that was terrific, and thank you. I know it's very helpful for all of us to get a better sense of how to navigate this new document and these guidelines. Will there be a way for businesses to let their clients and other customers know that they're adhering to these guidelines?
It's a great thought, and I would encourage companies can do it proactively in posting things that they're doing, giving some assurances. There's no restrictions to it. The task force has recommended the consideration of a non-mandatory certification that a restaurant, for instance, could post in their window or online showing that they adhere to certain guidelines. That's not been considered how to operationalize yet, but I think it's something that if we don't get quite there, if it doesn't come along, it's something that companies should think about how they can do their own version of giving their clientele confidence that they are abiding by great guidelines.
Wonderful. Thank you so much for that and for helping us understand how we can keep businesses going. Andrea Thomas is a professor of marketing and assistant dean of undergraduate studies at the David Eccles School of Business. And she's going to introduce our panel of business owners and leaders who have fallen under the category of essential businesses during our initial phases of restriction for COVID-19. And they're going to share with us how they've developed ways to practically take what they've been. I'll turn it to you.
Thanks, Steve. So we're very grateful to have 3 businesses represented here today to give us some tips, as Steve mentioned. So we have with us John Garf, who's the Chief Executive Officer of Garf Enterprises and part of the Ken Garf Automotive Group, and that's the area that he's going to be talking to us about. We also have Bob Nielsen, who's the Managing Partner of Nielsen Ventures. He's the co-owner of Sidecar Donuts, and then he's been involved in the restaurant industry for a long time with brands such as Cafe Rio and Taco Bell. And then we've got Bryce Jolly with us. He's the co-owner of Jollies Gifts, Floral, and Pharmacy. All of these businesses have been open because they are essential businesses, but they definitely have not been doing things business as usual. They've needed to make some adjustments, and they're going to share that with us here. So John Garf, we'll turn it over to you first. Thanks so much for being here.
Thank you for having me. Just a couple thoughts for me. I mean, we all live in this new world of constant change, and with an unprecedented, incredibly fluid and dynamic situation that we're all facing, there's discrepancies everywhere, and we've heard some examples of those. But it's easy to get lost in all that noise. And so for me, the clarity that I would share with you is that you focus on, number one, what you can control. And so, for example, when it comes to information, I found that it's great actually to have good local expert data sources like the good people and the entities that they represent that you've heard from today. Let those experts be the ones to analyze and go through the information so that you can then turn 98% of your focus to your business. So that's the first point of clarity, is focus on what you control. The second is to err on the side of having an abundance of caution, especially as it pertains to employee and customer safety. So the next slide, just a couple examples as you focus on what you can control. I apply to just about any business. First, leadership matters. Your optimism, realism, transparency, certainty, etc., all matters. And don't sell yourself short. Make sure that you focus on your own leadership and your leadership style. One quick example is there are 2 guiding principles that we shared with our 4,500 employees in early March. It was priority 1, it's employee and customer safety. Priority 2, fight like hell to keep the doors open. And those 2 simple things were very clear in understanding for our employees, and it was a way that we could get them aligned in one common cause. So that's the first point. The second point is about daily communication. For example, the last 35 days, 2 hours a day, 7 days a week, we've been on the phone with our regional vice presidents, our vice presidents every day from that 2 hours. That was our top-down approach for communication. After that call, we had our RVPs would then meet one-on-one, 1v1 with their general managers so we could get some bottom-up information. The combination of those 2 things every day provided a just-in-time learning environment for us to iterate our successes and failures and help us navigate an ever-changing set of circumstances. And so that was the second point. The third point is that it's imperative that we have good data to make good decisions. And daily KPIs measured across 52 locations. I mentioned the categories that we have below. Of course, yours would be different. Every business would be different. But those KPIs became the content for our daily communication that we would iterate every day, because the circumstances in Michigan were very different store by store than they were in Utah or Texas. And so that's where we take that information and we pull the levers that we needed to pull on a given situation, a given region. The last 2 items there together, just managing ever-changing employee perceptions, employee and customer perceptions and expectations, was something that we were doing every day. And I think in this new world of new normal, for example, if a customer has a mask, your employee should have a mask. It's that simple. Secretary Levitt shared the importance of being vigilant about social distancing as another example. Those are things that we're just constantly pressing with our employees and to help everyone feel safe. And in this new world of adapting to the new normal, it's adapting rapidly to new conditions and new business opportunities. How we've done that is to listen to employees and listen to customers. And then that's how we figure out daily what we're iterating. The next slide, just very briefly, is just the point about employee and customer safety, how we were acting with urgency and clarity. There's 2 examples you can look through if you're interested. The takeaway here is that the guiding principles is to have an abundance of caution when it comes to safety. And the last slide, again, very briefly, is that our rally cry of fight like hell to keep the doors open was very effective to keep employees focused and aligned on what they control rather than worrying about things that they can't control. And the takeaway again here and these business survival tactics is these were some things that we did, but the takeaway is for you to create your own set of business survival tactics and routines that apply to your business and continue to add to it often. So I hope that's helpful. Thanks for listening.
Thanks, John. Quick question for you. You're about 5 or 6 weeks into it. Have you noticed that your leadership approach or your leadership style has changed the longer that you're in the middle of the closing in the pandemic? And any tips for people as they think about how they're going to be approaching their teams?
I think the biggest thing I would just reiterate is that it's the daily communication. What's changed for us is that level of urgency and clarity in the beginning was pretty intense. For the last 3 or 4 weeks, it's been, like I said, 7 days a week, 2 hours a day, plus. This last weekend was the first time we didn't have a call, for example. And so those are slowing down just a little bit. But it's that just-in-time learning environment of that daily communication is how we're iterating through our successes and failures throughout the process.
Great. Thanks so much, John. Bob Nielsen, you have been in the restaurant business for quite a while, and the restaurant business has been something that's changed quite dramatically. I think everybody has experienced that. Can you give us some thoughts on how you've approached things within your businesses?
Absolutely. Let me first state, John, thank you very much. I would just want to point out one thing that has been touched upon. And I cannot emphasize enough how important the communication piece is. And we also went to daily calls. Anytime a manager had a problem, we'd get all the stakeholders involved and solve it. And they knew that they were our most important focus. And so just by way of background, I've spent most of my life in the restaurant industry, from washing dishes to waiting tables at the roof while I went to the U. I had the opportunity, as Andrea mentioned, to be the president, worldwide president of Burger King, and two of us ran Taco Bell. Took Cafe Rio from about 6 restaurants to 100 or so, and now have 4 very small, 600 square feet to 1,000 square feet, high volume restaurants in California by the name of Sidecar, if you have the opportunity. On or about, it would have been March 12th, it felt like the wheels all fell off simultaneously. I have never seen such a drop in my life. And before I get into that, let me just state, I recognize that having worked in everything from fine dining at the roof to fast food, some are being even more successful than they were, and others are looking at bankruptcy, if not bankrupt, or fighting for survival. And so my hearts go out to each and every one of you. So the bottom line is, on this particular day, our sales literally started dropping. In one store, they were down close to 70%. Another was in the 60 range, another 50, and another 40, which for anyone that has the pretty good understanding of the economics of a restaurant, you've got to be clearly at 80, 70, 80%, or you were really start to hemorrhage, pretty badly. And so we immediately just set out to do a few things. First and foremost was to keep our team members and our customers extraordinarily safe. So we immediately, started sanitizing, getting face masks for the people in the stores, plexiglass. We'd only limit a few people in the store at a time. We had, little placards outside where they would stand for social distancing, all of those things. And I could go on, but suffice it to say, we took every precaution. It was interesting to see that a few days into it, one of the stores, the manager called in and said, "Look, sorry to say, but I'm not feeling well." And the assistant manager, the roommate also, so we had to put them into quarantine. And but then 6 employees called in, and so we had no option but to close down that store. In hindsight, that was a blessing, because what we were able to do is to, and this really is a key lesson learned, is to reallocate resources to the stores that can stay open. And so we went to work, and I'll tell you, let me just give you an idea of some of the things. We said, look, our business is down so much, we have to adapt, we have to change, we have to do it now, or we will be out of business. We cannot sustain business at these levels. So immediately we went to work, and I said, look, 10, 15, 20 years ago, we did to-goes. So let's get phone lines in the stores. So immediately we said, look, 2, 3, 4, 5, 6 phone lines. People call one number, they'd roll one line to the next, to the next, to the next. And all of a sudden we had kind of an instant to-go business, but we now needed to establish a point where they could pick up the mill. So we set up an awning, what do you want to call it, a branded awning out front. So we had express to-go, and now we had a phone-in business. We then had literally about $600 a week of the the delivery companies. Many of you know you've got Postmates, Grubhub, Uber Eats, to name a few. And we said, we've got to go to town. So we got those in place. We got Postmates and then Grubhub, Uber Eats, etc., and got the dining business. Now, simultaneously, we were communicating to our customers that we had that going on. And so that business started to take off. So we then got working on our app, which, sorry to say, we'd just been slow in getting that out, and said, we've got to finish the app and get that so people can place orders online, pay online, and handle all of that. So between, I can't tell you, you know, and looking back, I'm actually ashamed at my own leadership in this, that I think under normal circumstances, this would have taken us maybe a year, year and a half, 2 years to get all of these things done. But as they say, necessity is the mother of all invention. I'll change that to adversity is the mother of invention. We just went out and together got assignments, followed up, and got it done. And I'll tell you, the business had been shifting, and these are very, very high volume donut businesses. You know, the customer counts we see is just out enormous. One of the things operationally we had to do is we had to get what we call friendly bouncers outside to do crowd control and make sure people were spacing themselves and you know, doing things appropriately. You know, and I say this with great humility because I'm just a phone call away from, you know, dire circumstances in any restaurant, but we have seen our delivery business grow just enormously. In some places, it's now running 35% of our business where it didn't exist. We've seen our to-go business pick up. We've seen this express phone-in business work. And so through all of that, the 3 stores are all up on prior year, and one of them is so busy we had to add one of our little trailers or cooking trucks to handle the volume on the weekend. So heart really goes out to especially our dine-in restaurants. What I would tell you, you know, having worked in that arena for many, many years, is hang in there. You know, look at what you can do to transition to go orders, higher check averages, et cetera, and then prepare for the you know, the events that are unfolding. But again, heart really goes out to our restaurant operators. And you know that as you continue to stay in the fight, stay positive, that things and adapt. I think the key thing is adapt and change to the new emerging trends of to-go, delivery, carry out. I think that's how you're going to be most successful. That's probably kind of the short, maybe not so short version of what happened with our little business sidecar. Any questions?
Thanks, Bob. You had some really great tips, very practical things. One of the questions that I have is, as you look at your business now, are you seeing things that you think are going to stick around? So permanent changes that you've made, or changes in consumer behavior that is that you think will be lasting?
Yes, Andrea, you know, I'm a student of the restaurant industry. I follow many businesses, and it's extraordinary to see the changes that are happening. And a lot of the changes are catering has become enormous. Tons of businesses are bringing food in for their employees, and that we'll get back to that. The delivery business, with the advent or the coming of all of these delivery companies, it's affordable, it's relatively easy. You've got to work your pricing to handle that, but that can be handled. So the delivery is here to stay. The off-premise is becoming an enormous part of the business. And I think anyone that doesn't adapt to the catering, the off-premise, and the to-go businesses are going to be, you know, in a very difficult spot. And I really believe that includes our dine-in business, even high-end dine-in businesses. I think we've got to find a way to, you know, capitalize on that as best I can. And so those literally, we have gone from literally almost no delivery to where it's running as high as 35 to 40% of our business right now. And, you know, we got there in 3 to 4 weeks through our communication, through our operations, and of course, you know, and hats off to our frontline people. The last thing I just state, Andrea, is I don't think we can do enough in taking care of those on the front line. Our managers, our team members, that's where it all happens. If we win their hearts and minds by serving them, then they will take care of our customers, and the business will flourish.
Excellent. Thanks so much, Bob. We also have Bryce Jolly here, and he is a co-owner of Jollies, one of my go-to places. I'm grateful to live nearby. And so, Bryce, I know your business, you're a pharmacy, and so you're an essential business, but you've got other parts of your business as well that you've had to make adjustments to. We'd love to hear a little bit more about that.
Great. Well, thank you. I appreciate the time. It's interesting to listen to the various dynamics from the other business owners. I'm just a mom and pop shop, and so there's not a whole lot of communication with anyone other than my staff and, okay, how are we going to get through today? A little background about Jollies. We've been in business for about 65 years, a family-owned business. My brothers and I expanded to different locations in the valley and then bought each other out from the different locations. So I have the location on 13th South and 17th East. In our pharmacy, as Andrea said, we are an essential business. So we have the traditional pharmacy services. We also do compounding, where you customize medications for patients. We also do a thing called Dispill, where we put medication in packs for seniors so that they can take a certain amount of pills every day, and family members can kind of watch what's going on. Those are all services that people tend to arrange ahead of time what's going to happen. And so when the pandemic hit, our pharmacy services kind of adapted, but we were already doing a lot of the things that we needed to. We had a delivery service, we had mailing service, we added curbside service, and as customers would call in to get their prescriptions, would say, hey, just give us a phone call, we'll run it out to you. We don't have a drive-up window, so we had to adapt to that model. But most people have been very interested in adapting and allowing us to do that. But every once in a while, there are people who want to come in, they want to talk to the pharmacist, they want to bring their prescription and they want to shop a little bit for over-the-counter items that they need. And so the rest of my store needed to remain open. A little bit of the rest of my store background, it's evolved over the years. And I feel like this is another chance to evolve. Initially in this building, it was an old video store, and it was the neighborhood hangout video store. And then when videos went away, we brought in women's clothing. And we had a little floral shop, and now it's expanded to a huge floral department. So we adapt to what the neighborhood needs and wants. So when this pandemic hit, we said, okay, we need to do something differently. We have someone at the front door greeting people and seeing if we can find what they need and bring it to them without them having to come into the store. We have a soda fountain that's very popular, and people come up, can I just get a large Diet Coke with 2 squirts of coconut and a lime? And employees will run and grab that and bring it to people, and just make sure that everyone feels comfortable. If someone wants to come in the store, they want to go to the pharmacy, or they want to just shop and look at merchandise and see what we have them put on gloves, and we maintain good social distancing, and the employees have been really good at adapting to that and making sure people feel comfortable when they come in. One of the things that was really advantageous for us, I guess, is that over a year ago, we started selling our clothing online and focusing on some online sales. When the pandemic hit, we quickly ramped up and started putting as much merchandise online as we could. And we were getting calls from people all across the country wanting our services. Some of my creative employees put together Easter baskets that we put online, and we were shipping Easter baskets all over the place, as well as people were calling up and wanting an Easter basket with this, that, or the other in it, and they wanted to come to the door and just pick it up or curbside. My florist, unfortunately, a lot of weddings got canceled, and she has weddings booked out long in advance, but she adapted, and we had Easter gardens put together, and we went through hundreds of those gardens as people were looking for something to to still bring some brightness into their life. We consequently, from the success of that, have now put in place, we're going to be doing a May Day basket, Mother Day baskets, things like that, that people can give to their neighbors or their family members. So it's all been a just on the fly for us, and look at what we can do. And I feel very fortunate that we've been able to survive this, and hope that when we move from the red to the orange to the yellow, things will continue to ramp up, and we'll be here to serve people. But I too, with John and Bob, my heart goes out to everybody who's struggling and who don't have the capability to do everything that you can. But whatever you can do, you probably surrounded yourself with very creative people, as I have, and those people are the ones that are going to make the difference.
That's awesome. So I have a question for you, because of how closely you work with all of your people at the pharmacy and the store. Have you noticed any differences or concerns that they've had in their working environment? And are there any changes that you've had to make, or things that you've been thinking about to keep your employees safe and comfortable making all these great ideas for your stores?
Yeah, I mean, all my employees are gloved all the time, and I have a couple of employees who were uncomfortable interacting with the public, and we've given them a temporary leave. We still stay in touch with them, and I'm hoping if things work out nationally, that the stimulus will come my way, and I'll be able to get some people additional payment that they've been missing. But we just adapt to the needs of the people. Some employees aren't as comfortable working with the customers, and we have them in the back room working on certain projects and things that still need to be done, where there's not quite as much interaction with the public.
Thank you so much. Steve, we've had a couple questions come in, and I wanted to pose the first one for you. Can you discuss liabilities and risks associated with reopening a business that has a lot of people concentrated, like a restaurant or an entertainment venue, prior to a vaccine being available? How do people open? How do they think about opening? And what are the risks that they need to manage?
Yeah, thank you, Andrea. Dell, I may see if you could give us your insights as somebody who's been associated with risk, and help us understand what businesses should be thinking about with those types of issues.
Yeah, Steve. So, I mean, I fall back to the tenets of basic risk management, and each industry, each business has to consider what I call the social density of its business primarily. And what I mean by social density is how many teammates do you have within the confines of your business, your restaurant, your drugstore, and what's the traffic volume that comes in and out of that business. And the two of those are what I call social density, right? The other part of this to think about it, I think it's a little subtle, is literally the turnover of air in your business is an important part in distributing the virus plume to less density. So if you think about the primary mode of transmission for the virus, it's inhaling it, getting it exposed to your mucous membranes. If you're in close proximity to a dense viral plume for an extended period of time, and I mean like 10 minutes, maybe even 5 minutes, there's a great likelihood that that virus will invade your mucous membranes, and you'll be infected, as your teammates, as will your consumers. So you have to think about how many teammates you have, what's the density of that, what's the throughput of traffic from your consumer base, and then what's literally the turnover of air in your business. And are you adding a lot of volume and turnover to that air? I was having a conversation with a friend of mine the other night that runs a restaurant, back to your area, Bob. And we were talking about how to ventilate his restaurant, including social distancing between the tables, to keep that volume of air turned over, as well as distancing the folks that are there. So those are a few thoughts, Steve.
Yeah, thanks. Bob, it would be, if we could follow up on that, it would be interesting to know, especially where you're in the food services industry, if you've had any experience thinking about that from a practical standpoint.
Yes, very, very much so. And let me start with Sidecar Donuts. These are very small shops, and our volumes, well, let me put it this way: in 1,000 square feet, we do in one of our stores close to what a 24-hour, 7-day-a-week McDonald's will do. They're high-end, fabulous donuts. So these we couldn't handle. So we literally, to Dale's point, would only allow a few people in our small to-go area at a time. And we had to change operationally by having, I mentioned, what we call a friendly bouncer. Someone's just very good with talking to the people, keeping the social spacing. And then during peak times, having that individual say, okay, a few more in, a couple more in, a couple more in, keeping that going. I think and then we literally spread out. So we had no contact, payment, right? Which is really a critical thing in restaurants. People are fearful of the credit cards. And then we also had another pickup point out front, again, outside. It's warm in California, you can do that. So the to-go place was not inside, it was actually outside with people running back to get the donuts. I think if I were a dine-in restaurant operator, the thing I would be looking at is how do I create those little social cubes, spreading them out, putting barriers in. What other restaurants normally have got HVAC systems, so there's a lot of air moving generally, but what else could I do to make sure that the air is moving and is clean? And then you've got those social distancing patterns in the dine-in restaurants. I think that's going to be the key to success there, and the other avenues we talked about.
Terrific, thank you. Andrea, what else do we have in terms of questions?
Yeah, Steve, there's been a few questions about making the plan to monitor your workforce for symptoms. Like, how do you make that a reality? So if you need the employers to do the monitoring, if you need to as an employer, get masks for your employees, are there certain guidelines or things that they should be thinking about once businesses move from red to orange and they start coming back up and keeping their employees safe?
Wonderful, great question. John Pullman, I wonder, in the work that Levitt Partners has done in supporting some of this guidelines development, could you give us any insights into that?
Yes, and Steve, I must apologize. My video just failed. Could you just repeat the question? I was working on a technical glitch trying to launch it again.
Sure. Yes, and I think we're all living in a time where our internet capacity is being taxed beyond what was ever anticipated. But Andrea, could you read the question again for John?
Sure, John. So it's around the plan stating that employers need to be able to keep their employees safe. And so you need to monitor for symptoms and well-being. And so is there a recommendation how people can monitor symptoms? And then also, if they need to provide masks for their employees, are you able to buy those? Can you use the 3D printed masks? Any sort of direction there to help people think about this?
Yeah, thank you. On the first one about employers testing employees, I think that really that will be a very new dynamic to have an encounter with your employee and checking their temperature and the like. I think the safest way to do that is a symptom checklist or a thermometer that is a non-contact thermometer, and you can understand that latter part. Those tongue thermometers could end up bringing you a lot more problems than they could solutions because of that contact and changing it. And so even restaurants have looked at sort of symptom checklists, and you can find some of these online where you're just asking people to validate and including things like, have you taken acetaminophen in the last 2 hours? Because it's possible their symptoms are being covered up by maybe a drug that they took. As far as masks, I think as they've grown is there's been a recognition that asymptomatic individuals can transmit using masks. It's become very popular and in vogue, and people to recognize that will create a desire to produce more. And actually, the Church of Jesus Christ of Latter-day Saints announced an initiative of trying to get 5 million masks available for, and some guidance on how to use those for people in Utah and elsewhere if needed. I think employers should really look to provide that if they can. I can't speak to supply or 3D masks, but those are good questions to investigate, and good for us to know that those questions are out there. So thank you.
Great. Yeah, thank you, John. And of course, we know there's quite a big difference between, say, the PPE, personal protective equipment type masks, and those that are less technical, but that are quite effective in managing the spread. So certainly, the latter is pretty easy to come by. The former is in pretty high demand. But thank you for those responses. Andrea?
Yeah, we have a question for Bob about just restaurants in general based on your experience. First, how likely are restaurants to be able to open here in Utah in May? And then when they do open, if they're asked to go to a lower density, how do they manage the top line revenue and expenses when the throughput and the model isn't like it was before, and it may not even allow for a break even?
Okay, Andrea, the challenge with restaurants is that we've got, really different concepts. And let me just quickly say, on a fast food, which I did for many years, Burger King, Taco Bell, KFC Pizza, a lot of the volume is done through drive-through. So you really just have to get your drive-through moving and then probably add a curbside to go. A quick service, Cafe Rio. Again, you've got these other channels, catering, curbside to go, etc. The challenge that they're going to have, and I talked to Steve Vaughn, who's running it now almost daily, is to start to utilize their line inside to have limited people come through. And I think restaurants, even like Valters, could potentially do this, is to have an inside to go line where a few people can go in and have limited meals made for them or call them in. And then I think the key thing is going to be to the question on masks. I think absolutely all of our people have masks. And in California, we now actually have all of our customers that are wearing masks, and we have some on hand if they by chance don't have them. And generally speaking, you can find those. But I think people are going to have to set the restaurants up to create spacing. I've seen some pictures in Hong Kong where they have, a group here, a small group here, and then physical barriers. We went to plexiglass to protect our cashiers and our other people immediately. People are going to have to think about spacing and barriers to create those little zones. So it certainly can be done, and then add the other channels to it. I think there's a fighting chance, but dine-in really is going to be the tough part that we've got to, just get through this curve as quickly as we can. Hope that's helpful.
Andrea, if I can, and thank you, that is terrific advice. Andrea, if I can just add too, we also need to remember that there are high-risk people in our population, and there may need to be specific considerations for those, both in terms of employees and customers. We know that those of our employees and customers who are over, say, 60 or 65, those who have underlying health conditions and are going to be at more risk for severe outcomes from COVID-19 than others. And so even thinking about that in terms of the way in which customers are treated and managed, and our employees are treated and managed, will be an important part of these adaptations.
Great point, Steve. There was another question, Dale, when you were talking, you mentioned to trust your instincts, not the tests. Can you elaborate on how personal responsibility and judgment weighs in on our personal and business decisions?
Oh my gosh, that's a tough one. Let me just start by saying that the reliability of our tests right now, and I bet Steve can even share more details about this, but the reliability of the tests that are available right now have false positive and false negative values that are as high as 60 to 70% in some cases, depending on the test. So, and I was joking with my wife the other night. We had a false pregnancy test a few months ago that scared us all a bit. So you just have to be careful while these tests become more reliable. You have to be careful about how much faith you place in the results, both false positives as well as false negatives. So it quite often could be the case that a patient who tests negative actually has the disease, and those who test negative have the disease, and those that test positive don't. So always look for symptoms, of course, be aware of symptoms. And by the way, the checking temperature is a valid way to check for symptoms. We're watching this in the data in our hospitals and clinics, but there can be a lot of errors in a lot of ways that create, false readings off of those thermometers too. So look for other symptoms, and the typical symptoms right now, are fever, dry cough, and body aches. Those are the very clear symptoms that are pretty predictable. And if you see those and you aren't seeing tests that validate an infection, trust your instincts first. I wish I could be more specific than that. It's a very difficult situation right now to give people good guidance on instincts over data. That's about the best I can do.
Yeah, let me just do a follow-up on that. I think there are a lot of complexities in how we identify who does and who does not have an infection. A good rule of thumb is simply, if somebody just does not feel well, if they don't feel right, have them stay away until they can figure out if this is something that is serious. We have to be oversensitive to this while we sort things out. We'll probably have better ways of identifying those who are infected in the future. But for now, if someone doesn't feel well, it's best that they're kept away from others so that they don't inadvertently spread the virus in case they have it.
Yes. Great. Thanks, Steve. Question for John Garf. You've provided some examples of your iteration for business success. Can you go a little bit more specific in that, where you talk about, especially as you're now kind of managing this longer term, what are some of the ways that you've iterated, or some suggestions you have for people on how they can iterate their business?
Good question. I think as I alluded to before, I mean, we have, with 4,500 employees, we have 100 successes a day and 100 failures every day. So it's kind of easy to find things. But I think probably a good example goes back to pickup and delivery on a service level. It's very, we've talked about it for 10 years, but we haven't had the impetus to necessarily do it, and a lot of people were necessarily asking for it. But in this environment, as we think about long term, and we think about this distancing issue, and we think about people feeling safe and getting out and so on and so forth, if we can if we can listen to our customer, provide something that they want, and we can use in a practical way. We've been monitoring every day the number of, out of our 52 stores, how many stores are coming online with a pickup and delivery service in their service departments. And that's one of those key metrics in adapting to these new business conditions. Just an example of how we've been focusing on something that's really important, that's emerging, but then how do we now go and execute that across 52 stores. So that would just be one example.
Thank you. I have a question for Bryce as well. Do you anticipate any additional aid from the federal government to help small businesses have a bridge to the new normal during this really tumultuous time? Have you been a recipient of PPP funding, or have you had experience with anything that's helped your small business?
I was in that donut hole, if you will, where we had all of our paperwork done. The application was into my bank. They had it approved and ready to submit to underwriting, and the funds ran out. So I'm ready to go. As soon as the funds are allocated, then the process will continue, and I'll be able to utilize those funds to bring some of my employees back and to get other employees who've been shorted their wage, taking advantage of that PPP, and that'll really help a lot in kind of bridging the gap right now. There's also a loan available for the disaster because of the earthquakes and things, that we were able to apply for an SBA loan. That's a little bit different, and I'm not really sure where that stands. I've had a hard time getting information from the SBA, but they're rather overwhelmed too.
Thank you, Bryce. So a question about testing, actually a couple of questions about testing. So can representative field testing help Utah manage this crisis? And then regarding the privacy versus testing balance, what happens if people need a test but don't want to provide the personal information or identify who they're in contact with for the testing?
Yeah, so I'll take the first part of that question, and then Dell, maybe we can have you respond to the second part. Yes, representative testing throughout the state is something that is starting to be initiated so that we have a better understanding of what is taking place beyond what has been detected. We detect what sometimes is referred to as the tip of the iceberg in terms of infection dynamics across the state. And so now, as testing capacity is increased and we're able to understand more of those cases that are more serious, our ability to look beyond that has increased. And so over the coming days and weeks, we'll see that type of testing underway, and that will help us get a much better, more complete picture of COVID-19 and SARS-CoV-2 viral activity that will help us as we make further plans and as a state adapt to and respond to and manage the COVID-19 pandemic. Bill, go ahead.
Okay. Thanks, Steve. Well, this is the challenge of any kind of contact tracing, going back to, the 1800s when epidemiology was becoming formalized as a science. It's up to the goodwill of those that are being tested to divulge their social contacts. And it's easy enough for those folks to choose not to divulge those contacts and hide that. It's easy enough for those folks to even, not tell the truth. There's even been cases in foreign countries where, people are actively attempting to infect others as a form of bioterrorism. So I don't know what we do about it really as a country. It's just, and as a society, I think Utah, generally speaking, has a more communal culture than most states. And I would hope that everyone would feel free in divulging their social contacts, but there's really no way that we can force it. And so that's about all I can say about that.
Great. Well, I have a final question for really anyone on the panel. We keep hearing about a long time. So when we go through the red, orange, yellow, green, it could take us a long time to get through it. And so when we think about social distancing and the impacts of COVID-19, what should we be prepared to think about as a long time?
And I'll ask John Pullman to give us his thoughts on that, given the work that he and his associates have done on even creating this risk system to get their insights about how they've thought about the timing of the easing of restrictions.
Yeah, well, and Natalie Gochner's really been a lead on this, and others in the governor's office. It needs to be metric based. There needs to be real data to determine what the appropriate timing is. And that's still being considered. Fortunately, the state of Utah is collecting a lot of great data. Testing availability is a critical component as well. And that's being amped up. And there is a human element to this as well, as we learn more about the virus. So to figure out what those milestones are and metrics, it requires that data, but then also requires some experts to look at that and say, is it really time? I can give you what we hope to be the case. We would really love to be into orange soon. I think the hope is maybe by the end of April, beginning of May. And we would love to be in yellow. I can't say exactly when that would be, but obviously as soon as possible. If we could get there within a month, that would be ideal. And then I think yellow is really that long stretch. That's the time in which it's pre-vaccine. We're going to open up the economy as much as we can. As you know, that could be 18 months. It could be longer. And so I think that's really, we should be thinking about the new normal. There's a shorter term new normal that we're going to have to really acclimate our businesses and just be in that mindset, as Governor Levitt said at the beginning. This is a long period, but that's sort of how we're thinking about the phasing.
Yeah, that's a terrific response, and I think going back to Secretary Levitt's comments at the opening of this webinar, we want to go long enough, but not too long, and so trying to find that balance of when it makes sense to start easing restrictions, and this method of gradually decreasing the restrictions and watching to see that we're doing that in a timely way is perhaps the best we can do with as many unknowns as we're dealing with. Andrea, I think that ends our question and answer period. Thank you to you. Thank you to all that our business owners and our other panelists, and we'll turn it back to Taylor.
Thank you, Steve, and thanks to all the panelists today. It's been a great show. We want to remind you that we are on every Friday and every Tuesday. This Friday, we'll be talking about how you plan and adjust for the new normal. As always, we thank the George S. and Dolores Dory Eccles Foundation for making this all possible. Keep your wits about you. We're going to get through this together. See you on Friday.